So I had the privilege of presenting the immune therapy approaches, our new targets for the immune system in MDS, in our MDS session this morning. Outside of bone marrow transplantation, we've been waiting for novel immune targets that have been more efficacious and safe for our patients with MDS. We had learned earlier in the day that patients with ALL have a startling number of active drugs that are potentially telling us that maybe some patients don't need to go to transplantation, and in the MDS realm it's quite the opposite. We still rely heavily on transplant. So in the meantime, we've been trying to identify novel targets. So during my session we talked about some of the older checkpoint inhibitors like PD-1, PD-L1, CTLA-4 blockade, where the activity has been rather mixed and not as positive as some of the newer agents, including those that target CD47 or SIRP-alpha, and those that target potentially TIM3. I also talked about some activity with the IRAK4 inhibitor looking at the innate immune system due to MDS categories that include splicing mutated disease that rely on NF-kappa beta. And so we are able to identify with looking at different disease subsets and with novel targets some potentially new therapies that could be promising. There are a few randomized trials that are ongoing that we're waiting for readouts from, and that includes the data with sabatolimab with hypomethylating agent versus hypomethylating agent alone, and the data with magrolimab plus azacitidine versus azacitidine alone. So we're certainly hopeful that there will be additional agents in the future and potentially immune therapies that are active.